I started.
Okay, so today we're going to be helping Daniel, who's had a right total hip arthroplasty. We'll be transferring him over to this wheelchair right here. Okay, so Daniel, how you doing today?
That was me when I was.
Okay, so what we're going to do to start us off is we're going to
Hello,
come
everybody.
up into a long standing
Okay.
sitting position.
You don't sound so excited to be here
all
on
we're
your
gonna do
last
here,
day of
Daniel,
class.
Right? Is I'm going to assist you as you come up.
You sound
and
very
use those elbows and hands
not
to
excited.
kind of
I'm looking
prop
for
yourself
more
up here,
energy.
Okay. So
Okay.
on three, we're going to come up. 1, 2, and.
I have a couple of things that I want to do in the beginning. I want to go over some common mistakes that I observed while watching all of your guys' videos from your last 3 assignments. So I want to make sure that you all get the same memo because not everyone gets to see everybody's feedback. So I want to make sure we all get that, and then I want to answer any questions that you have about the practical. So I'll start by answering any questions that you have about the quiz or the
to
practical.
prevent internal rotation. Okay, so we're gonna start this off. Ready, Daniel?
Yes.
So we're just gonna scoot these legs over, nice and slow, and this one I will help guide along. There you go. And guide. Good. And guide. There you go. Feels okay there?
Feels good.
All right, so we're actually going to stay right here while I put this gate belt on.
Okay.
Daniel's kind of pretty
I
strong.
appreciate your honesty about
Strong
not
right
being
here
able
so
to
he can
move
hold
that.
himself up.
Thank you for that. The answer to the question that was asked about, basically, the short of it for the other room is, what's practical going to be like? And the answer is that all of you guys will get a little scenario. Today you will have practice scenarios. They will be in a very similar format to what you will receive on the practical.
This wheelchair up.
These scenarios are a little bit
And those
hard.
locks on.
Okay, but if you can solve these scenarios, you're in good shape, okay?
Ooh,
So don't let that freak you out, let that motivate you.
Okay, there
That
we go.
if you're like,
So,
oh, I
I'm
really
gonna
have
scoot
to
'em
think
up
hard
just a
about
little
that,
bit.
that's good, because that's what we have to do every day as
Come
PTs.
on up. There you
You'll get a
go.
scenario,
So from here,
as soon as you get that
what we're gonna
scenario,
do
your 15-minute timer starts.
is
In that
we're gonna
15
come up
minutes, you're gonna
to a
like
standing
read the little
position,
case,
and I'm
think
gonna
about
put
it for a
him
second.
into
Your
this chair,
patient
right?
is going to be getting
So
into
on
a
three,
hospital
Dan.
gown
Okay.
and laying
Remember,
into the
try
bed
not
that's
to
already
lift
covered
right
with a
leg so
sheet.
much.
Your task is then going to be to
Left leg,
select the
and then
correct
come
bed
up.
mobility,
On
to
three.
get your patient up to the
There
side
you
of the
go. If you
bed,
can,
select
push
the
with both
transfer to
hands
get
as
your
well.
patient into
Ready?
the chair.
On three, 1,
At that
2,
point,
and 3. Stay.
Some of you will have a second
Good.
card, some of
And
you
now
will
we're
not.
gonna take a nice little
Because
bend with that right
the
leg.
second part is
And
either
nice and
gait
slow. Can
training
you feel
or
those armrests
curb
behind you?
slash
Yep.
stair
Using the guide you
training,
as you come
okay?
down.
Some of
There
you
you
will
go,
have a
nice
second
and
card
slow.
because some of your patients may have magically
There you go.
progressed and we have fast forwarded 6 weeks in time,
There we go.
okay? So what that means is that
Okay, Daniel, so it's been a little bit since you first came in, right? Good news is there's no longer any weight bearing restrictions on your right side.
All right.
So, good for you. We're going to be teaching you how to use this cane so you're a little bit more mobile and also how to step up onto this little curve here, okay?
All right.
So just to demonstrate, we're going to start with this cane on our left side. And really simple, all we're going to do is step forward with your right leg and the cane at the same time. 1, and you're going to step through with your left leg forward. So 1, 2, 1, 2. Very fluid motion, right? That's our goal here.
All right.
So to stand this up again, if you want, you can just grab that. And you can put your right hand here on the wheelchair. Now, no weight bearing restrictions, so you could really help me. I'll just be here for some assistance, right? All right, so one other thing, with this cane, you're actually gonna grab it right here with the handle, right?
Okay.
A little bit better positioning right here.
Okay.
So if you can, kind of bend your feet a little farther back. There you go, right there. That just helps us with the whole motion right there, right? I'm just gonna grab this gate belt on 3, 1, 2, and 3. Nice. How'd that feel?
Feels good.
Feels good. All right, so we're just gonna practice that pattern that I told you about, right?
Okay.
So left cane and right foot up together at the same time. 1 and through with the left. Together, through with the left. Good? As close to the curve as possible. Okay, now, I know we don't have any weight bearing restrictions right now, but we're gonna keep going with this left leg, since it's your strong leg.
Mhm.
You're gonna step up here. There you go. And
Okay.
on 3, you can step all the way up, and once again, together. There you go. Forward, left, together. We're gonna take a little pivot, right? Smaller steps here, perfect. And now to go down, instead, you're gonna come down. Remember, try to look straight up here.
Mhm.
And you're going to come down with the cane and the right leg at the same time again, right?
All right.
So that left leg is gonna control your way down.
Okay.
Ready for that?
Yep.
1, 2, and 3. Try that. Nice. And then we continue walking forward, through, together, through. Nice. There we go.